Hi, and welcome back. We are here today from the Resiliency Project. I'm Sarah Shulman, the director of the Resiliency Project that is really has the focus about how we can care for ourselves so that we can care best for others. Also, that we have this innate wisdom that if we can tap into is so profound. And here with me is Ramona Smith, this amazing nurse practitioner from Santa Cruz, although now she's living in North Carolina for the time being. And she has been such a wealth of knowledge for me. And we are here today to talk about early morning awakening. A lot of you have been asking me to talk about sleep. And the last time we talked to Ramona, we talked about staying asleep. And I think this time we're going to be talking early morning sleep. And then, yeah, I'm going to leave it to you, Ramona. Thanks for coming.
Thank you. So I would like to talk about this concept we have around sleep that has to do with early morning awakening. And often when I see patients, I ask them, do you have trouble getting to sleep or staying asleep? And sometimes they say both. And I've come to realize that the early morning awakening, usually between the 2, 3, or 4 a.m. time frame, is often seen in concert with anxiety or maybe an anxious depression. And we have some ideas of things that might be helpful. And there, you could look up sleep hygiene. It's kind of a funny phrase, but there is an actual concept about how to prepare for sleep and how to maintain your sleep, having a room that's comfortable and cool. And one of the things that can help before going to sleep is to take a hot bath in Epsom salt, or if you're able to take some magnesium. I prefer magnesium glycinate, which is a kind that crosses the blood-brain barrier and helps us kind of relax to get ready for sleeping. And what do we do when we wake up with that anxiety? That is the key to getting back to rest. Many times people will wake up and the first thing they do is they reach for their telephone, okay, or their cell phone, and they start streaming or they start looking. That's probably the quickest way to teach yourself that habit to wake up early and be anxious, especially in these changing times with lots of different news that's coming in that can be disconcerting. It's really important that that's not your go-to, that you don't pick it up and go right away to the phone. If it is an anxiety, sometimes we need to think about, is that our anxiety or are we picking it up from somebody else? A lot of the clients that come in, I'll do Western medicine with them, and they'll want to maybe have a pill or some kind of a magic way to make this not happen. But what we really have to look at is, where's the anxiety coming from? Is it coming from them? Is there a family member that's sort of tapping into their energy and sort of ruminating that anxiety for them as well? So it's important to kind of figure out, where is that coming from? If possible, when you wake up early, in that early time, and sometimes people wake up and they're breathing fast or their heart rate is fast, do some deep breathing. Sarah has some wonderful meditations, guided meditations, to try to do that. Put on some quiet music. Keep the lights low. The last thing you want to do is get that your eyes and your face and everything lit up with anything from a computer or a phone. You want to keep everything low. The deep breathing often can help you go back to sleep. So the thing is, you want to teach yourself a habit of, you wake up, don't fret about it, don't watch the clock, don't worry. Take those deep breaths and try to say something calming. If you have a mantra, a lot of us as healthcare people, we've come up with ways to calm ourselves. Find what works for you. And we can talk about a lot of options at one of the other interviews that we do. But it's important to recognize that it's okay that you're up during that time. And it's okay that your sleep is interrupted. You will sleep again. And often, if you can get yourself back down to sleep, the best sleep that you'll have will be from that early morning awakening until when you actually have to get up. That's the deepest sleep. That's the most REM sleep that you would have, is during that time. We can talk more another time about the difference between what is our anxiety and what is somebody else's, because it's really important to differentiate that. There's many people in this world, and particularly in the US, that are medicated with benzos or benzodiazepines or other sedating medications to reduce the anxiety that really isn't theirs. So I'll leave you on that enticing little bit of information, and we're at 5 minutes. So I don't know if Sarah, you have any questions? You want to add anything?
I mean, the only thing I would add is that what I have found sometimes is that actually that awakening is, you know, a time that you can actually listen intently in a meditative way to what the message is that's coming to you. So sometimes I feel that that is part of the reason that we're awoken for, because there is a message that needs to be imparted, and it's a quiet time, and so if you can take that and then just and say thank you for the message and move on, I find that's a really helpful way too. So thank you, Ramona. So
You're
awesome to
welcome.
have you back, and we thank you for tuning in, and hope that these are helpful. If you have any comments, please comment below, and we'll see you the next time.
Thank you.